All right, state officials expect 2 million visitors among him to come for the World Cup. So how do local leaders plan to keep everybody safe?
Joining us now, Dr. Biddinger, Chief of Preparedness at Mass General Brigham. Great to have you. Well, he might need something for blisters.
Yeah,
who knows?
Sure.
But overall,
we're ready if he needs it.
Yeah, amazing. Boston, the city of champions. We're title town. Hospitals around here really do know how to plan for big sporting events. So what do you think about the World Cup games at Gillette? Is there a different challenge here?
I think there are some different challenges for sure. It's not just that it's one football match, but really it's several within a month succession. And as you said, we know how to plan for big events. We have the Patriots. We've thankfully had a lot of national sports celebrations here, but getting so many people from overseas, shuffling visitors from city to city to city as the World Cup matches go, and the special security restrictions and access restrictions that come with it, they do give us a different set of challenges.
All right, so the MGB locations, there's a pair of them in Foxborough. They're going to be closed to patients on match days. Does that mean there'll be no medical staff on site either?
No. We actually, with our medical teams, are supporting the fans at the stadium to make sure that that they have access to great health care, and we're supporting the players and their medical teams during each of the matches. But because of those security restrictions, there's actually decreased parking. Some of the challenges that that our patients would experience getting to the Foxborough site on match days, we've elected to close. But we've rescheduled those patients. We've given them access to other care sites across Mass General Brigham, and we want to make sure that match days are just as easy for the patients as they are for all the fans going to see the games.
You know, it's a kind of a unique setup, Dr. Biddinger. I want to ask you a follow-up on that. Do you guys use those facilities when there is a medical issue at the stadium? You know, I know at a lot of other venues across the country, you got to get in an ambulance and go, 5, 10, 15, 20 miles down the road to a hospital, but you have both those facilities right there outside the door.
So there are fantastic medical facilities for the players inside the stadium, and then again we have urgent care facilities also for the fans inside the stadium. But our Foxborough care facilities are just urgent care level, not emergency care. So we work very closely with EMS, with fire, with other planning officials, and we have access to all the local emergency departments as well as to the trauma centers if ever someone has more significant injury.
Understood. Okay, so we know you have to be ready for anything. What's on the list, and what typically do you see most?
Well, I think what you see at any sort of sporting event is what you'd expect. Unfortunately, there are little accidents, other things that can happen. But as I mentioned, what we're having is a lot of fans come from all around the world and reassorting, going from match to match, different city, even different countries, the way that this World Cup is hosted. So we are on the lookout for infectious diseases. We work very closely with our city and state public health officials for surveillance systems. And even though the mantra of emergency preparedness is to prepare for the worst and hope for the best, it does mean we have to have plans in place if ever something were to happen, even though we think that's extremely unlikely.
All right, Dr. Biddinger with Mass General Brigham. Thanks for your time. We appreciate it.
Thank you both so much.
Thank you.